Hi, everybody. This is Zach Perry, the legislative chair of THAC, and I wanted to give you another one of our monthly legislative updates. I've been getting some questions around the No Surprises Act. And so today we're going to talk for a few minutes just about what that is, why it's a problem, and why Congress decided to act, and where we are now in terms of the implementation of that legislation. So, No Surprises Act was passed by Congress in 2021 and became effective, or was supposed to become effective, January 1st of 2022. So what is surprise medical billing? So like many of you, I've received medical bills in the past, and I consider myself reasonably intelligent, and I can't make sense of them. I have no idea what, these really large numbers, and then they go down to these sort of hard to understand numbers that I owe. Very hard in network, out of network. All of this stuff is very complicated, and even for people in healthcare, it's just tough to understand. So what Congress was trying to do, the act mandates that where patients do not have the ability to shop for or give consent for out-of-network care, there are limits on the ability of the facility or the provider to recoup costs in excess, or charge fees, I should say, in excess of in-network arrangements, right? So you have your in-network providers where your insurance is covering them at a higher rate, and then you have your out-of-network providers. But let's use an example to really understand what this act is trying to target. So the example I'll give you is if you're going to get surgery, and you're going to get surgery on your shoulder, but that shoulder surgery requires you to go under anesthesia. So you're at your in-network surgical provider, and you have an anesthesiologist who is out of network, and they, put you under anesthesia, and then the surgery is performed, and later you get a bill, and you get this huge bill because this anesthesiologist was technically out of network, but you never consented to an out-of-network provider or treatment. And so that is the exact type of incident where you're getting a much larger bill than you had necessarily understood you were going to be getting. And that's the sort of, lack of transparency that undermines people's trust in healthcare. And it also leads to huge excess costs on the healthcare system. So let's talk a little bit about some statistics. Why did Congress decide to act on this, right? For Congress to do something, you generally have to have some pretty big problems that have some pretty large numbers attached to them. So approximately 1 in 5 patients receives a surprise medical bill. And just a quick side note here, what we're talking about is private insurance. We're not talking about government-sponsored programs like Medicare or Medicaid or the VA, because those programs have fixed fees arrangements. So really, when we talk about surprise billing, we are talking about employer-sponsored healthcare, private health plans. All right, so annually, the government estimates 40 million emergency room visits per year, right? So 40 million emergency room per visits per year for those with private insurance. And of those, 7 million will have a surprise medical claim, a out-of-network claim. And that leads to an estimated $40 billion of excess cost for specialty healthcare and for these employer-sponsored health plans. Let's give one example. Where could you get a very large claim? If you are involved, or a person is involved in an accident and they have to be transported by air ambulance, well, that air ambulance can be out of network. And those bills can often range into the hundreds of thousands of dollars just for the air ambulance. So you can see why some of these bills can become really large, and it does become a real tax on the system. So that's what they're trying to eliminate. They're also trying to give people, they're trying to ensure providers can give better estimates, good faith estimates to patients when they're receiving care. They actually put in a provision that says if your final bill differs from the estimate you were provided by more than $400, you can actually dispute that bill. And then there'll be some sort of arbitration. There's an arbitration process whereby you can try to, both sides can try to resolve the difference. But again, $400 more than the estimate you were given, the good faith estimate you were given, and you do now have a, the act creates a dispute mechanism. So where are we? The bill was passed in 2021. The other thing to keep in mind, Congress will pass bills, and oftentimes they are not the experts that understand the real, nuanced details of everything that they are going to be enacting. So they'll task departments within the government to do additional rulemaking, to kind of fill in the blanks, right? Fill in the gaps. So the interim final rule associated with this was released in September of 2021. And the American Medical Association and the American Hospital Association both filed lawsuits in December of 2021 for relief, for injunctive relief, to stop the implementation of this act. And I've been involved in processes like these before, where Congress passes a law, some agencies within the government will issue some rulemaking, and industry groups, who are the ones then tasked with effectively operationalizing this and understanding how to avoid fines, which I think in this one, I think you can be fined over up to $10,000 per incident. These are sort of pretty specific. These are pretty significant fines. So I mean, getting it wrong, really isn't an option. So you have to figure out how to operationalize it. You have to figure out how to change processes. All the way from intake of patients all the way to the billing. You have to figure out what changes need to be made. These are really large, complex organizations, so I do understand the challenge there. But I will say this: there's a lot of common sense in this, right? None of us want to receive bills that are sort of a lot higher than we expected, but contain these aspects that we never really consented to, and now we're sort of being given this very large bill at the end. So there's a lot of common sense here, and I hope that there is some resolution to this. I do not think at this point that it is currently being enforced. I think there is that process of rulemaking, and going back and forth with industry groups will likely take some more time. It may be resolved through the courts, which is unfortunately sort of how some of these things play out. But I hope that gives you a little bit more information on what the No Surprises Act is, what they were trying to solve, and where it is, but why there's some really good common sense elements to it. So thanks very much for listening. Stay tuned. Please let me know if you have any questions. Thanks.